I want to talk about aging lips, or things that we do to make lips look better. And to make it easy to think about, you can think about lips about the same as other body parts. Things droop over time, right? Things get thinner over time. You lose volume like in your breasts or your cheeks, and then you can get wrinkles too, right? So let's talk about what we do with lips. The simplest thing that we do of all age groups is to add volume to the lips. So someone's in their 20s even, they want a little bit more fullness in the lips, especially I say sort of from here to here, a little bit more fullness in this way, especially more on the lower lip. That's an easy thing to do with just injections in the office, maybe every 9 to 12 months, or using fat as a filler if we're already in the OR, for instance, doing something else. And then another thing that we deal with is drooping of the lips. The upper lip actually gets longer with time. When you're younger, you can see some of the upper teeth here. And with time, pretty much everyone gets this longer, thinner upper lip, and you can't see the teeth at all. And what we can do there is sort of a classic lip lift, where maybe we're making an incision kind of across here, taking out some skin, and when we sew that up, it brings the lip back up into a better location. But sometimes after we take the middle part up, then the tops are kind of down. So what we would do is take out some skin along the edge here, and that lifts up the corners as this lifts up the middle. So overall, you're getting the lip back into what looks like a fuller upper lip, because now the lip's this high. But what if we've already treated drooping and volume loss and someone just has bad wrinkles? People call them smoker's lines around the mouth. Everyone's going to get them eventually, whether you smoke or not. Maybe it happens faster in that case because of the loss of elasticity. When you have bad wrinkles around there, sure, if you plump the lip up a little with some fillers, it might help some. But if it's really that wrinkled, we need to iron it, basically, with laser resurfacing. This whole area, think of it as sort of smoothing it or sanding it down with the laser. Much more of a recovery with this, like 2-3 weeks, versus just plumping things up or doing a little lip lift. On the other hand, there's really no alternative to getting rid of bad lip lines compared to a laser. We try to avoid it if we can, but if that's what someone's biggest concern is, then that's pretty much what we need to do. In summary, if someone's young and they just want their lips to be a little plumper, maybe they're even normal, we just use some fillers. That's the easiest thing. The most significant thing that we do on someone with the oldest looking lips is adding volume. Maybe in the OR, we put some fat grafting in here, make them a little bit plumper in the middle, right? And it's still droopy. Look at that distance from there to there. So we take out some of the skin here, pull it up. So we roll the lip out. And then finally, for all these lines, barcode as someone called them, we laser that and smooth it out. That's it. That's the spectrum of the easiest to the most advanced things that we do for rejuvenating the area right around the mouth.